Hello, this is Bob Leahy. I'm from PositiveLight.com, and we're at the OHTN Research Conference today in Toronto. And yesterday we had a presentation from Adam Moscovitch, who's with me today. Adam, welcome to the OHTN. You're from the University of Calgary, right? And you deal with sleep disorders, right?
I actually live in Toronto, but
okay.
Recent transplant from
Okay, and you have a practice in sleep medicine?
I practice sleep medicine full time.
So you know a lot about sleep and HIV too, and this is what you were talking about yesterday. And I was actually very interested because I've been around a long time in the HIV world, and this is the very first presentation out of hundreds I've seen that we actually connected HIV issues and sleep issues. Why do you think we haven't addressed it before?
Which partially points out the degree of the problem. This is the first time actually that anyone put together a workshop which was initially aimed at healthcare professionals, specifically looking at sleep issues in the HIV patient population. Mm-hmm. The reality is that very few studies have been done in this area, in spite of the fact that sleep problems and sleep disorders, same way like in the general population, but are also very common in the HIV patient population.
I was going to ask about that.
Now, some of it has to do with the fact sleep medicine is a relatively new field. It's about 20 years old. The general medical knowledge out there in the medical community is also quite limited.
Right.
So we are very much on a public awareness and on an education campaign as a first step.
Right. Okay, so you mentioned sleep problems are actually more common in the HIV community than they are in the general population. What sort of numbers are we talking about?
Some of the issues are the same like in the general population. The belief is that about 10% of the general population is chronically sleep deprived, and then you have about another 10 to 15% of individuals that will have a significant sleep disorder. Right. Now that's different than the occasional sleep disturbance, which we would all have. What is, in addition, unique to the HIV population, some of the additional problems are related to the illness itself, such as the impact of the infection, in particular on the central nervous system, in terms of causing fatigue and sleepiness, which obviously falls in the sleep area. Some of the issues are medication-related, some HIV-related medications, including some of the other medications that people might be taking. And there is an additional element which is related to the stress of the illness, some of the associated psychiatric conditions such as depression that might be there. And the last element, which again is relatively unique, is the fact that a large percentage of individuals might be on disability, hence not having the regular night and day work structure. As a result, they have a shift in their body clock.
So how much sleep is enough, typically? How much do we need?
Most of us need between 6 to 8 hours of quality sleep.
Right.
So the issue is also not only the number of hours that you get, but also the quality. And if you're not getting any of the deep stages of sleep that we need in order to feel refreshed, you might be asleep for 15 hours and still feel like you were run over by a truck.
Okay. I think I relate to that. I often wake up tired. So that's why I was particularly interested.
You're not alone.
Now, one of the things that I think probably people in the room picked up is the connection, or the possible connection, between treatment issues, the treatment they're taking for HIV, and how that might interact with their sleep patterns and sleep issues. And the one that comes up is a lot, and it will resonate with a lot of people watching this, I think, is Sestiva. And that has traditionally been associated with nightmares, and that's kind of resultant disruptions. Talk about that a little bit.
That was one of the triggers that led to putting together this workshop initially. There is a relatively small percentage. It doesn't happen in every individual, but one of the known recognized side effects of Sestiva is having nightmares or vivid dreams, and in a lot of individuals are quite sexually oriented.
Right.
Now, interestingly, in some individuals and some patients tell me that they enjoy the dream.
They have sexual
they
dreams,
don't
they
want
like it.
Sexual dreams, that they actually like it,
Right.
and they don't touch it.
So they want to keep us to see.
But obviously, in some individuals,
more
like
serious.
the case that I presented yesterday,
Yeah,
it can trigger some traumatic experiences
Right.
from the past, and it can be a nightmare experience.
Right. So what would be your, if you diagnosed that it was Sativa related, what are the solutions? To take yourself off Sativa, or are there other
No.
options?
And that was exactly the message that I was trying to relay yesterday. The knee-jerk reaction would be that since it's associated with a medication, we should switch to something else, and that's exactly what we want to avoid. Because the duration of those nightmares is usually self-limiting. It normally goes away within a period of several weeks, 3 to 4 weeks in most individuals. So the key is to manage the symptoms and get them under control for that duration. And the example that I showed yesterday was the case in point, that there were no appropriate alternatives for that young man to consider in terms of convenience of once-a-day medication. So with appropriate behavioral measures, and also a small dose of a particular medication that helps, such as some of the benzodiazepines that help control nightmares, sleepwalking, night terrors within a period of 3 weeks. We made it completely go away. We discontinued the medication without any recurrence.
All right.
It was no need to change the medication.
All right. So the key I think I'm hearing is that it's a short-term, typically it's a short-term side effect. It doesn't happen with everybody. And if you do have it, the key is to manage it.
Very much so.
Right. That's good to know. I think people will be interested in it. I'm curious, sleep problems with people with HIV could be HIV related, but they could be a whole bunch of other things having. How do you distinguish with it? How do you diagnose sleep problems?
Well, a simple way is to use a basic screening questionnaire, which we actually developed specifically for clinicians. It's a simple 2-page questionnaire with a key. The clinic nurse can hand it out to the patient. It takes about 5 minutes max to complete. You can tabulate the results. So before the doctor even asks you a single question, it will give you an index whether you are suspected of having this condition, that condition, etc.
So then you can narrow in on
and then you can narrow it
Mm-hmm.
in. Okay, we developed also some additional useful tools such as a sleep log that can be available for people to document their schedule over a period of 1 to 2 weeks. And then there is an algorithm of how to approach various problems in terms of identifying whether they are primary or secondary. Now, we have what we call primary sleep disorders. And those can be things such as sleep apnea, which is a breathing problem in sleep.
Well, you have to have the mask.
Not necessarily.
Not necessarily
The mask is
okay.
one treatment
Okay.
approach. There are others, but it's one of the more common and effective ones.
Right.
That's usually a breathing problem that most individuals are not aware of. They think that they just snore, and underneath that, they might stop breathing several hundred times.
Right.
Then you have a lot of individuals, in particular if you have any peripheral conditions, such as some individuals have peripheral neuropathy, that can have the leg clicks and the leg twitches. Okay. The other one is a creepy, crawly sensation in the legs that we call restless leg syndrome. And then there is the connection between quality of sleep and our immune system.
Right.
If you're not getting the right kind of sleep, it has a negative impact on your immune system, makes you much more vulnerable to certain infections, and makes it much more difficult to fight certain infections, including HIV.
So I think I'm hearing you making a case for screening to be more mainstream, more part of the kind of routine checkups that people will have. Is that what I'm hearing from you?
That's the key message.
Yeah. It's not right now, is it, at all?
It doesn't take a lot of time.
I have never been asked about my sleep patterns.
And sadly, that's still the
So that's your take-home message, is that we need to take sleep problems more seriously.
Sleep should be viewed as one of the key pillars of health. The same way like nutrition and exercise,
Right.
because it's definitely not a wasted time. We need sleep for all kinds of things, for recovery from various injuries, for energy conservation, for transferring things from short-term memory to long-term memory, for problem solving sometimes. It's a requirement for certain health elements such as cardiovascular health. Okay, certain sleep disorders increase significantly the likelihood of the patient developing diabetes, heart conditions, high blood pressure, irregular heartbeat at night, heart attacks, and stroke. And the last area that there is quite a bit of research going on is a connection between sleep problems and obesity. It's actually, that's frequently not an area that some HIV patients might be worried about, okay? But if you are having an underlying sleep problem, the likelihood of you gaining weight is much higher, and it's much more difficult to lose weight because it affects your energy level plus the hormones that control appetite.
That's good. Adam, I think I'm hearing that sleep is important, it's good for you, and we need to take it a little bit more seriously. Is that right?
Very much so.
Well, thank you, Adam. That's a good message. Thank you. Thank you for talking to us. And this is Bob Leahy from Positive Light from the OHTN Research Conference in Toronto. Thank you for coming.
My pleasure. Thank you.
Good job. Good job.